look through our first responder bag and learn what's inside of it. Yep, perfect, smooth. In our miscellaneous pouch, so this is different for each bag, each paramedic, depending on the jobs. We've got a couple of pouches of glucose. We have our absorbent pad, and we have some masks. In the top pocket here, we have our vital signs kit. So we've got our thermometer, a stethoscope, some scissors, and some pupil torches, along with 2 different size blood pressure cuffs. In our left pocket on the side, we have our glucose, pre-ready glucose and some liquid glucagon, along with some liquid glucose again. In the side pouch, we have C-spine collar, which will attach on patients if we haven't checked their C-spine, some sick bags, and some pain absorbent for some. It's got some ethyl chloride. In this big pouch here, we have our trauma kit. So we've got some tourniquets, some bandages, different sizes, slings and gourds, some more bandages, and also some saline. So keep the bandages moist, so then when we're wrapping them onto the patient, it's not going to stick to them. So now, after we've done all that, we can look through our main pouch. So in the first pouch, we have our main drugs containing such as ibuprofen and also our green whistle or methoxyflurane to help with pain relief. In this pouch here, we have multiple sized OPAs along with some NPAs, our forceps, so a hazard bag, and the laryngoscope with a little bit of lube in there just to help with the NPAs. Okay, this pouch here we have our drugs for our nebulizer, and we also have our SET nebulizer as well to help with airway. We have a slippery Sam if we were to move patients from, say, one bed to another or from somewhere to somewhere else. We have our LMA in this pouch here, and we've got different sizes for different patients. In this bag here we have our neonate masks and also our neonate bag valve mask for the size of their lungs, quite tiny. And we have our adult size BVM as well, along with the adult size mask. In this blue package here we have our IVs, so we've got our sharps in here. We also have our sharps container if we were to use such a bag like this in the vents. We have a towel, which is quite handy for handling hemorrhages or providing proper airway. We have our C-spine collar to help mobilize the neck, and also our splint for any broken or fractured limbs. So in this video we're going to learn how to use our monitor or our life pack defibrillator. So first off, I'm just going to turn it on and give it a test. So by that, press the on button, and I want to put it into manual mode by clicking advisory. So it'll prompt will come up whether I want to go into manual mode, and I want to click yes. So to test this, I'm going to go to options, scroll all the way to user test, and click the button there. All it's going to do is test. I'm going to just let you know about the anatomy or all the gizmos that are with the monitor. So at the top here we have our end-tidal CO2 measuring pump that you attach with the mask. We also at the bottom here we have our SpO2 monitor, which levels your saturation or capillary. We have our 3 lead, and we have a non-invasive blood pressure cuff on this side. On the other side, we should have a 12 lead, but we don't for the simulation. We also have our defibrillizing pads, and within here we have a razor, GTN, and also some aspirin. At the back of our monitor, we have our batteries. To test battery life, you just click these little buttons here, and if they're low, you just simply take them out by unplugging the battery and replacing it, like so. In this pouch here, we have our spare battery, spare paper, and at the moment, still testing. But after the test is done, I'll be showing you how to do done. It says test passed, so perfect. Now I'm going to be testing how to use our test load to check that the defibrillator is working. Like that, I want to select energy level and change it to a lower amount of joules, just because it's a test. Click OK and press charge. As it's charging and making the beeping sounds, I need to press shock to administer the shock. If I want to cancel at any time, press charge. While it's loading or while it's charging, I press the back button to cancel the charge. So now, furthermore, just always test if there's enough paper in here by flipping the lid up like so. Alright, now I'm going to attach on myself my 3 leads, so then I can monitor my, my heart rhythms. So before I do that, I want to get this set up. With my finger, press lead and go to my 3 lead option that's on the monitor. Now I have to attach the 3 leads. So with that, I have to get my patient's permission first. Do I have permission? Yes, I do. Okay, great. Now, these are all labelled. You got your left arm, which is up top here. We have our right arm, which is the white, goes up here. Our green, which is our right leg, which goes up here. And our red, which is our left leg, which goes onto here. So now I have on my screen my heart rate and my QRS waves. So to change the size of the waves, I want to click size and then go either up or down to make the waves smaller or bigger. I don't want the waves too big, otherwise it can give out a false reading of, say, too hypertensive or sort of heart rate. And I also want to change the volume. So by doing so, I want to swivel the nozzle up to the top left corner here, click your S wave and change volume from there. Yes. And if I were to go back onto defib, I want to click analyze.
Analyzing now. Stand clear.
That's how we use our monitor. Okay, so in this video we're going to learn how to use a regulator, our oxygen tank, and how to attach nasal prongs onto a patient. So first off, it's really important that we have a Bach seal on our regulator that prevents any leakage. So if we had a full oxygen tank, it's very good or wise to, while it's in this position, twist to the left to let it bleed out. So if there's any dust inside the oxygen tank, it's not going to affect anything in the oxygen supply. So let's attach this. So we've got 3 prongs on our regulator. It's going to fit on like so. Perfectly, like a glove. Now on our regulator we have our gauge that tests, or that shows us how many litres of oxygen that we have in. We also have our little knob here which demonstrates or shows us how many litres of oxygen is being pumped out. So to test this, we want to turn this to the left and have this gauge on 0, and we want to test that all the gauges from 1 to 25 are active. By 25 meaning 25 litres per minute. At the moment for this demonstration we don't have any oxygen in the tank, so the readings are going to be 0. But it is good to still practice, say if we've got this off, we want it to bleed out so we don't have any inaccurate readings if someone else were to use oxygen. So let it bleed out all the way up to 25 and back down. Great. So now we're going to attach nasal prongs onto our patient. In doing so, when around a scene, got to make sure that our tank is lying flat on the ground to prevent any hazards caused. Okay. From one end of the tube, we're going to attach it into our regulator. And with our nasal prongs, we're going to come around to the neck of the patient here, making sure that the prongs are facing towards the patient, sliding them in like so, looping them around the ears, nice and comfortably, and then tighten this if we need to. For nasal prongs, we don't want them to be too evasive, so if we were to give them oxygen, turn this on, we want the dial up between 2 litres to 4 litres of oxygen per minute. This is so that we can give our patient, say, 20% of tanked oxygen, and this is usually used for patients that are normally on an oxygen air supply normally. So any complications that this cause, if I were to give too much oxygen through the nasal prongs, will cause irritation and possible bleeding in the nose, which will make for a congested airway. In this video, I'll just be learning how to use our suction unit. So just going about the anatomy of our suction unit. We have our rigid catheter, also known as a yanker. The rigid one's pretty good for using against patients that are in resus. But if we're in a vehicle, moving vehicle, we want to use our soft catheter. So we also have our tubing, which is attached to our capsule. Capsule inside also has a bag, so if we're taking out too much fluid or too much vomiting, we can interchange the bag during the resus. We have a clear water bottle here, so if there is any debris within the tubing, we can easily clear it out by putting some suction into the water bottle. We also have our battery inside this here. So I'm going to test whether this works. So by doing so, I have to put a kink in the hose, press and hold the test button, and put the nozzle all the way up. So this gives us 2 different readings. It gives a reading for our battery life and also the suction power measured in mercury. So at the moment that's looking pretty good. Good battery life, good suction. So we can now use it on a patient. So when performing suction on a patient, we want to make sure that they are either unconscious or we'll use it if they're unable to regurgitate or do any suction, or regurgitate by themselves. So when using this on a patient, turn this on. I want to make sure I am pushing this as far as I can see. I don't want to go too far or it could cause some damage in the throat or the mouth area. As I'm inserting this, I want to put my finger on this away from the hole. Once it's in, as far as I can put it in, my finger is now going to go on top of the hole of the catheter and do circular motions all the way out. I don't want to do this for no longer than 10 seconds per suction, as it could cause a gag reflex for the patient or induce some hypoxia. Done.
Alright, in this video we'll be learning the ins and outs of the bag valve mask. So here we have the actual bag, the PEEP or the positive and expiry pressure valve, the mask itself, the filter which helps or stops any sort of fluids going into the actual bag reservoir, and the oxygen bag. So simply to inflate this to make it a bit easier rather than clawing at it, hold firmly at the bag end, squeeze, so then the air sort of pumps out. To test the actual bag to make sure that there's no tears, hold it at the set end and inflate it until it's fully inflated. Okay, full setup. So you want to put PEEP on first. Okay, you don't need a PEEP during the resus, as that will be explained in the next video. Our filter and our mask. So to attach this to an oxygen tank, here the bag sit at the end, and we'll put this on between 12 to 15 litres per minute on an oxygen tank. The usage of the bag will be explained in my resus video.
Overlapping farting.
So we're on the scene to a 65-year-old male. Wife's just called, say that he's collapsed, clutching his chest. So we're going to go to the scene, make sure everything's safe. Are you okay to do chest compressions for me?
Yep.
Awesome. Okay, so before we head off, before we get into the scene, we've got to make sure that we've got a clear passage, a clear entry and exit for our vehicle. So as you're in the scene, just surveying the area, everything looks safe, good to go in. Alright, hello sir, can you hear me? Okay, so no verbal response. Hello sir, can you hear me? So no pain response. Okay, so I'm going to check his airways. No, so there's nothing in his airways. I'm going to look, listen, feel for breathing. Okay, he's not breathing. Can you start CPR, please? Okay, AT1 to comms, we've got an R49, requesting an R50. Okay, so we've got backup on the way. I want to make sure that I get my defibrillator charged up and ready. And I'm going to set this up around my partner. So just for this, these aren't going to stick so well. These are just for demonstration purposes. So stuck on, turn that on.
Analyzing heart
Okay,
rhythm.
step away from the patient.
Do not touch the patient.
So by this time, I'll be calling the wife, making sure that I know his medical history.
Shock advised.
Oh, CPR.
Charging.
So medical history,
Stay clear
and
of
making
patient.
sure that I know what had happened prior towards this
Deliver
event.
shock
Okay,
now.
step away from the
Press
patient,
the
not
orange
touching the
button
patient.
Now. Shock delivered.
Okay, start on CPR.
Pause.
Okay, well,
Start
chest compressions are
CPR.
underway. I'm going to work on airways. So the first thing I'm going to do, get a towel, place it under the patient's neck. So I'm creating a nice open airway. Okay, and I'm also going to get my bag valve ready. Cool. I don't need PEEP for the airbag, for the BVM, as it's a resus, but I do need to attach it to my oxygen tank and pump it up to between 12 to 15 litres per minute. So count down to 30. So I want to make a C grip with the BVM bag and inflate it to 1/3 of its size.
28, 29, 30.
So making sure that there's a chest rise. Okay, keep going. I'm also going to insert an OPA. So this is good for patients that have got a GCS lower than 8, preferably 6 in motor skill. So I'm going to insert it backwards, perpendicular, and scooping it around the tongue.
27, 28, 29, 30.
So now I have an effective airway. However, this may not be effective if the person has got trismus or locked jaw, or has got a gag reflex. So that's when I'm going to turn to my NPA, which I'm going to measure from the nose to the earlobe. So I'm going to slowly protrude it, twisting, looking for protrusions or resistance, with my way till it gets to the end. So again, 1/3 of its size. So NPAs are good for those that have got a GCS lower than 6, and this doesn't cause a gag reflex, but it does. It is quite irritable to the nose. It could cause some bleeding.
29, 30.
Stop CPR.
Okay, so we're going to swap roles.
Analyzing heart rhythm. Stay clear of patient.
Okay, and
Analyzing heart rhythm.
so
No
safety-
shock
no
advised.
shock advised.
Pause.
Okay, I want you to demonstrate a double hand
If
grip for me,
needed,
please.
start
And
CPR.
just count my compressions. So during this time, the ICU unit will be on their way. For the backup that's needed. So with the BVM, I don't want to inflate it too much, that's why I only do it 1/3 of its size.
29, 30.
Because if I inflate it too hard or too fast, it could burst the alveoli, cause thoracic pressure, and that's another reason why I wouldn't use a PEEP valve.
27, 28, 29, 30.
So a little bit about the NPA. It's always good to lube it up first so then it can easily go into the nose. Okay, by this time our backup would have arrived, and that is how we do a CPR. Recess.